Ginseng is a perennial herb that belongs to the elderberry family. It is native to the Korean Peninsula, Manchuria, and Yeonju provinces, which were formerly part of Goguryeo, and is still used today as a synonym for Korean ginseng. In the Chinese medical book Xin Nong Bon Chokyung, 365 types of drugs are categorized into 3 classes: high, medium, and low, and ginseng is included in the high class. The medicinal properties of ginseng are described as protecting the 5 bowels, stabilizing the mind and brightening the eyes, and making the body lighter and longer lived if taken for a long time. For the first time, 21 specific prescriptions for ginseng, 113 in total, are listed in Jang Joong-kyung's Sanghan-ron during the Han Dynasty. The 467 prescriptions in the Bangyak Hapjeon, a Korean herbal prescription book still in common use today, are divided into 3 categories: upper, middle, and lower, with upper pain prescriptions called boje, middle pain prescriptions called hwaje, and lower pain prescriptions called gongje, and so on. About 94% of the 132 prescriptions containing ginseng are for upper and middle pain, indicating that ginseng is used as a supplement or tonic, not as a treatment for specific diseases. To summarize the recognized medicinal effects of ginseng in Oriental medicine, it is widely used as a tonic, strengthening, health-correcting, and calming medicine, and is used to promote metabolic function due to weak gastrointestinal function, and is also applied to stomach upset, indigestion, vomiting, chest pain, and loss of appetite in the infirm. However, it is recommended that people with high blood pressure and people with high body heat take a small amount to see if it works for them before deciding whether to continue taking it. Scientific research on the medicinal properties of ginseng began to develop rapidly in the 1950s, and there have been many results on its composition, pharmacological effects, and clinical studies. Saponin glycosides, which are currently recognized as the main components of ginseng's medicinal effects, are known to have anti-fatigue effects, work capacity enhancement effects, sex gland development effects, and blood sugar lowering effects. In addition, ginseng has been studied for its ability to promote bioprotein and DNA synthesis, as well as for its anti-cancer activity, but most of the research is conducted in East Asian countries such as Korea, China, and Japan, while research on ginseng is relatively rare in countries such as the United States and Europe. From a modern medical point of view, objective and scientific studies on the efficacy of ginseng are still rare and limited. Recently, at the 10th International Ginseng Symposium, held at the Olympic Park Hotel from September 14 to 16, 2010, hosted by the Korean Ginseng Society, Dr. Sang-Moo Kang of Emory University in the United States presented a study showing that ginseng has protective effects against lethal infections with novel influenza viruses and that daily administration of ginseng polysaccharides or ginseng extract improved cross-protection against other subtypes of influenza viruses in mice. 8. Ginseng has been shown to protect against influenza viruses of different subtypes. Taken together, the physiological, biochemical, and pharmacological findings of Korean ginseng to date suggest that it may have the following benefits: maintaining the body's homeostasis by acting as an adaptogen, improving learning function, improving memory loss and improving the efficiency of intellectual work, relieving pain, preventing cancer, inhibiting the proliferation and metastasis of cancer cells and enhancing the anti-cancer activity of anti-cancer drugs, anti-diabetes, improving liver function, regulating blood pressure, anti-fatigue and anti-stress, inhibiting the proliferation of the AIDS virus, HIV, improving female menopausal disorders and male sexual dysfunction, antioxidant activity, and anti-aging effects. The main active ingredients in ginseng are known as saponins or ginsenosides. which are complex carbohydrates, complexes of sugars with alcohols or phenols. They have central nervous system stimulant and sedative effects, regulate metabolism, reduce blood sugar, enhance muscle activity, stimulate the endocrine system, and maintain proper hormone levels. In particular, most of the saponins in ginseng are triterpenoidal Damaran saponins, which are unique to the ginseng genus. Saponins in plants have hemolytic properties, and the saponins in ginseng are neutral glycosides with little toxicity. In addition, the pharmacological effects of ginseng saponins are significantly different from those of other medicinal plants. The molecular weights of ginseng saponins are panaxidiol, 460 and panaxitriol, 476. Acid hydrolysis of the glycosides yields free sugars and aglycones. Panaxidiol, panaxitriol, beta-sitosterol, and oleanoic acid are known as aglycones of ginseng glycosides. With the development of multi-analytical instruments, the chemical structures of 37 ginsenosides, ginseng saponins, have been found in Korean ginseng. Meanwhile, 14 ginsenosides were found in Panax quinquefolius L and 15 in Panax notoginseng Burkle. Based on their chemical structures, the saponin compounds can be divided into three groups: protopanaxidiol, PD, 25, protopanaxitriol, PT, 11, and oleanine 1. The total number of saponin compounds, 37 ginsenosides, in Korean ginseng is much higher than that of Panax ginseng, 14 ginsenosides, and Panax ginseng, 15 ginsenosides. In particular, ginsenosides RA, RF, RG3, and RH2 are not found in American ginseng and are unique to Korean ginseng.